Important, how terrific. And Tariq, you demonstrated very well why moderators are virtually redundant. That was a great conversation and a great learning curve. I can't resist adding one very small footnote to what I heard, and I hope you'll forgive me. It's this. Dame Sally said rightly, she talked rightly about the disgusting fact that 80% of antibiotics, very frequently in most countries, certainly in the UK, gets into animals. And I just add this, for the last decade or so, in the UK, as in other countries, there are sustainable farming organisations, I used to be president of one of them, that have campaigned about that, having produced the evidence for quite a long time. You come up against, as Sally says, you come up against the powerful farming lobbies, but they're under pressure from the supermarkets to get cheap food because the public demands cheap food, so we have a vicious circle in place. So one of the great challenges, as you say, is to get buy-in from the consumer, from the supermarkets, from the big farming lobby, as well as from those who know it's absolutely awful for you. Sorry, I just had to say it because it's a bee in my bonnet, it has been for a long time. Forgive me. I was at this point going to introduce Anthony Shriver, who unhappily, though, can't be with us. He can't make it, which is, of course, a great shame. But actually, it allows us to do something which I think you will really appreciate, and it really matters. I've had a chance to go around and see some of the showcases in the gallery, and actually I've been really filled with wonder. It's invidious. I know a lot of you have too. It's invidious to pick out any one example, but from what I've seen, I'm just going to do that, and two of them stick in my mind. One which is an app which allows virtually anyone with minimal training, in a school, for instance, to use a smartphone to take a picture of the retina of a pupil, send it instantaneously to the relevant clinic, and equally swiftly get back an answer as to whether or not that student, that pupil, needs treatment for a potential eye infection or eye damage or eye weakness. It seems to me to be a sort of universal no-brainer, as we crudely say. I've also seen a 1-litre bag that sterilises water, however unclean it may be. And that is a bag that you can take empty to any part of the world. Imagine at the extreme there's a cholera outbreak. You can send a pack of 10 empty bags which take up no more space than 1 full litre bag of sterilised water, and less weight, of course, than the traditional filled bag. The empty bag can be filled with dirty water. It's cleaned of its impurities within 5 hours, and then can be used straight away to rehydrate patients. And the sterile water, in addition, can come directly from that bag for the rehydration process. Just think of the possibilities. I could give you, as I suggested, many more, but it takes us nicely, I hope, into this session. I want you to hear from tomorrow's people. I say that. What I really mean is today's young who have the challenge and the talent to create the tomorrow, which has an almost limitless potential application for innovation of all kinds. So I want the following, if they would, the following 4 people to come up to the panel and join me here. We're going to sit here because we're reaching the sort of informal part of this terrific 2 days, so we're going to sit here. Adepeju Jayoba, first of all, Mark Arnoldi, Mariam Al-Dosseri, and Ahmed Al-Katani. So would you come and join me? We've got to get your microphones. It's a long way to come. There we are. Come relatively close, because otherwise it looks as if we can't bear to speak to one another if we're too far apart, but I hope we can. Let me start, if I could, with you, Peju. Simple question. Why are you here?
Okay, so I'm here because I run Mothers Delivery Kits, which basically provides sterile supplies and connects women in rural communities to the life-saving supplies they need at childbirth.
In childbirth?
Yes.
So you're basically making childbirth safer? Exactly. And is that a business that you came to out of the blue? Did it suck you in? How did it happen? Okay, so for me, my turning point was the death of a close friend at childbirth, whose death now puts a face behind every maternal and child death I have, statistics I have seen. So I've been saying numbers and numbers and numbers, but when you know someone who has died at childbirth, they no longer become numbers. They're now becoming real people to you. So when you see the numbers, these aren't numbers, they're real people. It's very interesting. So what you just said, all through these 2 days, again and again, we've heard from people in very key positions, very often saying that what brought them to be engaged with the sort of passion that is required to have an impact is personal experience. What's yours?
At a fundamental level, I'm here because I believe in proving it's possible to make this seeming elusive pursuit of high-quality, low-cost care possible for the world's poorest people. And I have the privilege of doing that with colleagues and government partners in Nepal.
Give me a brief.
Yeah, we're working in a unique public-private partnership in Nepal's poorest region to deliver care across hospitals, clinics, and community health workers. We've been doing it for 6 years. We've delivered care to nearly 250,000 patients at under $4 per capita.
$4?
That's right.
Can you deliver care for less, even in a relatively low-income country, you can deliver health care for $4?
Well, we have 6 years of experience proving you can do it at this level, though I think I should make clear that I think that number should be higher. When you look at Rwanda and some of the great successes they've had, for example, that figure is about $55.
And how do you achieve it? Because it's easy to say, I want to do it. How did you achieve it?
Well, we build right into the government's existing infrastructure. So as a nonprofit healthcare company, we deliver care in their infrastructure, and we get paid based on performance. So we only get paid if we deliver population-level outcomes that really matter and are aligned with the national health objectives of Nepal.
So you've got something underway, you both have. What's been the point of coming here? Has it been useful? Either of you, both of you? Yeah.
Oh, absolutely. I think at first, when I was leaving Nigeria, I was a bit confused. I did not really know what to expect, but it has been super amazing so far. Here, you meet decision makers, you meet influencers, you meet people who, they do not have a direct connection to what exactly you are doing, but, they're also able to make referrals and, lead you on to other people. For me personally, I think no statement is truer than the fact, printed out there, that a healthier world through global collaborations. So that's what has been happening here. Even within the collaborators, within the showcase innovators, there's been some kind of collaboration. For me, I've got offers from other innovators about, let's just build you an app. Let's do this. Oh, have you thought about this? So it's really working perfectly for me. I'm happy to say that.
Hear a bit more in a minute. Mariam, what brings you here? Because you're not a medic, are you? And you're not an entrepreneur. No. You're a student.
Yes, I'm a student at Georgetown University here in Qatar Foundation, and majoring in international politics. I'm really interested in the policy making behind the global healthcare issues that the world is facing today. And as a future politician, policymaker, diplomat, whatever you want to call it, I really want to educate myself on such policy making so that I can really make an impact in the future.
And has it been, we've heard quite a lot of people here in various sessions saying, and we had it in the last session, how do you get through to finance ministers, treasuries, those who are the money bags, and say to them, actually, for instance, this stuff that we've just been discussing, infectious diseases and everything else we've been discussing, it needs resourcing because it's fundamental to human health, human development, economic growth that is sustainable. Do you kind of feel that this is that what you want? Is when you hear this, what goes through your head? Do you say, yeah, that's it, or what?
Exactly. I feel like that's the connection that I was trying to make when I came here. Like Professor Dame Sally mentioned in the last panel when she said that the connection, something about the connection with the policymakers and the politicians is what is needed, and the understanding. So I feel like that is where I come into play. Even though I'm not a doctor, I'm not a medic, that's where I think I would be helpful in terms of these global healthcare issues.
Ahmed, you are a medical student. So why are you here?
So I'm a third-year medical student at Weill Cornell Medical College in Qatar, and aspiring ophthalmologist, inshallah. So I have a lot of dreams, but two of them would be, number one, a world with no diabetes, and number two would be basic health care for everyone, as it's a right and not a privilege.
How did you come to... You have ample opportunity. You live in a very rich country. You've got some wonderful medics, but there are all sorts of other opportunities. And without, I hope, being offensive, and I don't want to be a caricature, but I bet you've been asked this before, you could have taken the option, I don't know what your family position is, but given the per capita income of this country, you could have said, well, I'm going to sit back, I'm going to have a very comfortable life. I might have a very fast car, and we know what the driving statistics of accidents here are, very great indeed, and kind of had an easy life for however long I live if I don't get diabetes. What made you decide again that?
All right, so as many of you already know, Qatar is a very wealthy country, and most of us Qataris are well off, and my dad is a well-known physician here, so I'm also well off. But the idea of doing something for my country is a dream, honestly, changing the world. I could have went to any other university for 4 years, got my bachelor's degree, worked in a cushy job, got a good salary, and stayed at home. But I want to change the world.
Has this been useful?
Definitely, it has been useful. I've met a lot of influential people, and I've made a lot of connections that hopefully are going to help me for my future endeavors.
Let me ask you one round here. I've just got time for one more. You're all going to be great successes, right? You've got the talent, you've got the dedication.
Sure.
At the end of the road, you know, when you're close to where I am in age, which you will all be beyond then because you're going to live over 100, what are you going to be?
If it's okay, I'm going to talk about what I want the world to look like in
Okay,
healthcare.
well, that's part of what you want to be.
Yeah,
how are
it
you going to
is.
contribute to how you want the world to be?
Great. I'm going to use a quote and a metaphor. I think there's a quote by William Gibson that says, "The future is already here, it's just not distributed evenly." And that's how I see healthcare. And the metaphor is cars and roads. Innovations in healthcare are the cars, and distribution is the roads. And so in the future, I actually want to see a lot of investment in the road building so that we can get all these innovations to patients, even in the poorest corners of the world. And I want to be leading an organization that's doing that. And I think in the end, I want to see that happen because I think it's good for everyone. It's obviously good for the patients, but it's good for medical device companies, it's good for pharmaceutical companies, it's great for governments. And I don't think we can live in a world where there's not healthcare for all, as my colleague has mentioned.
Mariam, that same question.
Well, I agree. I think we all here have the same kind of vision of what we want to see in terms of healthcare in the future. But specifically with my position, I just want to be able to, from this conference and from any other opportunity that I may get, gather the knowledge I require about the pressing healthcare issues that the world is facing today. And really, once I get to the position where I can make an influence, where I do have a very prominent voice, make sure that I address these issues in the most effective way possible and help those, such as the young innovators as we're seeing here, get like the funding or whatever the means they need necessary to achieve their hopes.
And Ahmed, are you going to be the next Minister of Health, bar 1, 2, 3, 4, however many it'll be?
Well, my plan for now is to be the best student I can, graduate and be the best ophthalmologist I can, and hopefully I'll be able to do research on the side on diabetes. And one of the common complications of diabetes, as most of you already know, is diabetic retinopathy, which can lead to blindness. So these are my aspirations, and I want Qatar to be the hub of everything, as it is. And I want people to come... I want people to say, I want to get treated, and I'm going to come to Qatar because it has the best healthcare in the world.
The best sell we've had so far. Sorry.
Okay, so for
Right.
me, three major things. I would like to see a future or a world where every mother has an opportunity to watch a baby grow. Every child has the opportunity or the chance to live his or her potential, and that the location of a woman at childbirth would never be an excuse to let her die.
And that's going to be your future.
Yes.
Hey, you're all great future leaders, committed people, wonderful talents. It's been terrific, has it not, to hear from them. Thanks a lot. You just leave that there, it's great. Well done. Well done. And now we come, in fact, to what has to be the very final part of Wish 2015. I know, because I've seen it and I've heard it, you've worked really hard, you've listened very hard, you've been very, very engaged in a very serious way, which is actually not always common in large conferences. The Wish app has been, as it were, red hot with you communicating with panels, communicating with each other. And it's that which makes this great enterprise really worthwhile. Now it is your chance to say what you think of Wish 2015. What's it achieved? Has it been productive? Are there ideas that you briefly, I have to say, want to share? criticisms that you may have or suggestions for the future. Where do we go from here? There are microphones everywhere up and down. You can see gentlemen carrying great big numbers, and they'll be near you, and I will summon the number if I can when it happens. But someone's got to be the butt of everything you want to say. Someone's got to take it on the chin. And there's only one person that can do that, and that is one of our present leaders, namely Professor Lord Darzi. So come into the firing line if you would. Ara. There, yeah? Great. At the beginning, I'm going to have to crave I'm just going to have to check. It breaks all the rules of conferences, but it says on my piece of paper here suddenly that we've only got 5 minutes or so. So I've got to crave the indulgence, Your Highness, if I may, for us to extend. Thank you very much. You're most gracious. So we've got about 15 minutes worth. At the beginning of this conference, you said that your aim for Wish is to make a real difference. I'm quoting you more or less from what you said, speeding up the adoption of health innovation around the world. So, assume for the purposes of argument, to quote from the last thing, that's ground zero. Where have you got to it, in your view? You may be told you haven't, you never know.
Well, let me start by saying I think this is a stitch-up.
Intended to be.
Absolutely. So, well, I think I'm the wrong person to be asking that question. I think it's the audience, it's the community here who will be able to tell us whether we've achieved what I said we hope to achieve.
Yeah, you don't want to put yourself up on a great platform and then have your shins kicked from under you. So let me ask you another question.
I'm a wise person.
You are a wise old bird. Now, just let me put one more thing to you before then I ask. Let me get an idea. Who's got things they would like to say? Would you show with just a way? Oh, terrific. Okay, right. We're underway. Lovely, lovely, lovely. So just before that, the one more. There are conferences and there are conferences.
Yeah.
And people of talent and ability and significance and all the rest, they go to conferences a lot. What do you hope, when you started this one, we had last year, what did you hope, you said innovation, but what did you hope would make this one very special?
I think this year, the 2015 one, I really do believe we have created a community of thought leaders, community of innovators. I'm fairly confident saying that. I think the talent pool that I've seen here, the discussions, the listening, the learning, plenty of evidence of that. I think the delegates we have, most of them are change agents. A significant number of people sitting here, I mean, we had 28 ministers, they're the change leaders. I think Don Berwick very eloquently gave us the recipe of change. How do you make that happen? I think Mark, yesterday afternoon, gave us a flavor. What does it feel like from a patient's perspective? So, always remember the patient voice. We could be as innovators as we want, but if the patient out there doesn't recognize that, doesn't feel that, we're wasting our time. I think Debbie Chetty this morning was absolutely brilliant in highlighting we can do all of this with very little money, low cost. How do you bring the creativity into it? I think the reports will diffuse globally. I think the alliances, the partnerships we build are very unique, and I think that will further diffuse later. I am pretty confident, and I speak in front of His Excellency here, the Minister, that Qatar and the Qataris in this room will implement what we've heard and what we've seen the last 48 hours. It's very difficult for Wish or QF to make change happen in the United Kingdom, but we've given people the tool to make that happen.
Right, I'm going to ask you to stop there.
That's where I think where we are.
Okay, I'll come back to you, obviously, and hope we've got some things. I'm going to stand up so it's easier for me to see. Okay, we've got all the numbers are flying. We'll start at number 5 down here, then we'll go to number 7 over there, then to number 6, then number 3, and then number 4, if you can remember that order, because I won't be able to. 5 first, down here. Yeah.
Yes.
If you feel like identifying yourself, if you want to have no name, no patrol, as they used to say, feel free, but it'd be nice to know who you are if you feel able to do so.
Bill Dunn from Rochester, Minnesota. We've heard of the struggles in creating a future of consistent excellence in performance within new systems of care here. Earlier, also, we've heard a vision of a global system of healthcare education online, supplemented by local experiences. We've also heard something of multiple mentions of an aviation analogy in this conference. Simulation, in fact, plays a major role in education, safety, and quality within that aviation paradigm. Where do you see simulation utilization within the tool set in healthcare's future?
Importance of simulation.
Absolutely. And I mean, Bill, you're well aware of my contribution to this area. I think it all started at the time in simulation and training surgeons in new techniques and new skills. I think what we've heard from the patient safety, as you correctly pointed out, we as a healthcare industry probably are the worst comparing ourselves with other industries like the aviation industry in terms of simulation and safety. I think there is a huge scope in simulating policy. That's the one thing I learned when I became a minister a while ago, where you could produce the evidence base, but in actual fact, if you really want to see the impact of that policy, you should try and find a way of simulating that policy within the context that you have to see the impact of that. But more importantly, there are untoward consequences sometimes when you implement a piece of policy. And I think there's a lot to learn from the defense industries that do a lot of simulations in that field. It's a very interesting area. It's not an area we've touched on here, with the exception of patient safety, but I certainly see that it's being a fairly useful tool in really designing systems and running them through a simulation. And with the computer and IT power we have nowadays, we can actually do some amazing simulations. I'm sure you've heard of the concept of virtual worlds and Second Life. I remember 4 or 5 years ago, I built the whole of the London landscape in virtual life for the simple reason I wanted the public to experience what it will look and feel like before the real thing is built. That was my way of engaging the user of the service and the public of what the future would look like. If you can demonstrate to the public what the future will look like, the buy-in politically will be much, much greater.
And that, of course, applies in virtually every area. That public buy-in depends on people understanding why it's a good idea. You can't just tell people it's a good idea because they're much too sceptical.
Absolutely. I mean, Don Berwick very eloquently yesterday described change is difficult in a hospital because doctors and nurses, we all come to work, we want to do exactly what we did yesterday or the day before. Now, if I could take you 2 or 3 levels above, a leadership in a ministry, or a leadership even higher, you want to make change, you will always find a significant amount of criticism to that change. So we need to find better tools to engage the public, the patients in case of health, and what does that change mean? Because if you don't get the buy-in of the public and patients, change is very difficult to do. And we've seen numerous examples, certainly in the United Kingdom, where change may result, for example, in losing seat in Parliament. So engaging patients and public is a very important part of change.
I'm not going to go on with this, but it would be very interesting in the United Kingdom if a minister who signs up to a policy, for instance, for very good health reasons, for closing a hospital, then goes back to his constituency and says, I'm in favour of closing this hospital. That's the big education and sharing and buying that's required.
Absolutely, but also a lot of nations are different in their way of thinking. Qatar is one place, they love change. In terms, where is the new one? Where is the next big thing? Where is the expectations are far greater than what we tend to do, or even in the US, change. I mean, you know, Obama reforms was about extending cover, the most honorable thing you do. But there was a significant reluctance because it wasn't communicated well. Back to our communicating complex messages.
Over here, number 7.
Yes, good afternoon, everybody. My name's Robert Johnston. I'm on the board of the International Alliance of Patients Organisations, and it's great to have the opportunity to feed back. My main comment would be very similar to the comment I made last time I was here, which is basically if we have 1,000 people at this event, when I quickly scanned down the list, there were probably only 5 or 6 that I could identify as specific patient representatives. Now, we've just heard the important thing is to communicate with patients. I would actually say involve patients, not present a vision top-down, but to involve them in the process, the analysis of what's wrong with the system now, to look together to create a vision and to work together to create that reality. And I'm still seeing very much professionally dominated event that's not really bringing patients into the process.
Thank you. And I've always accepted this criticism. Wherever we are, you can never do enough in patient engagement. You can never do enough. And I agree with you. The only thing
should you have done,
on
the benefit of hindsight, should you have done more? Is the implicit.
The answer is
criticism.
yes. We could do more. We can invite more patients. But it's important to also say they may not be here, but we've listened to patients. If I could just come to, for example, the patient safety. We had a patient safety representative there. Margaret, who's, I'm not sure she's here, she made sure she came despite her cold. We've had patients in more or less every forum. And let's not forget the global health diffusion study we did. Some of the qualitative surveys were mostly talking to patients in terms of that. So I'm not trying to defend the situation. I'm saying you can never do enough in having patients. We will always make sure we will increase the contribution of patients, also the public. It's not just the patients, because, and finally, if I could just make one more point, we are all patients here. And I think that's also important to remember.
5 next, and then I'm going to break my own rule and go to 4 so that we get a bounce. 5 next, down here, yes.
Hello, my name is Bonnie Cherbovsky. I'm coming from Mexico, and this is my 3rd year in Qatar in the WISH. And I would like to thank you because I take back home a lot of knowledge and new friends. But I would like to ask you more participation from Latin countries. We have great experiences also that we would love to share with our friends here. Thank you.
No, don't sit down. What kind of greater participation would you like to have had, or you would like to have, were there to be another? Well, there are often events of this kind that might be. What do you feel you weren't able to contribute that you would like to?
Well, we have spoken about very important issues like, child and mother mortality. We have great experience. My husband has a research hospital in Mexico that is now evaluated by the UNAM. And they prepare nurses and midwives in that aspect. Also in diabetes, we organized a lot of things for society to create awareness and impact in programs involving schools, children, and the diabetes people that are sick on that. So we have a lot of good things to talk about it that we would like to participate next year and share these experiences with our friends here.
Thanks very much.
Well, welcome from Mexico. I could only say that we've had many more friends and delegates from South America. We certainly did much, much better than the last time. From Brazil, from Mexico, from a number of other countries.
Someone said to me as they were walking around, I didn't expect to hear quite so much Spanish spoken here.
Absolutely. And that's why we've had some Spanish translation too, as you will recognize. So welcome. We have, if you see some of the reports, certainly last year's reports, some wonderful examples of innovation from Mexico, telling the use of mobile telephony in delivering primary care services. And I'm sure we have more to exchange and learn from each other.
Number 4, and then I can take 3 more only after that, which are here at 3, then at 2, and then at 6 there. So they're the last ones. Sorry.
Thank you very much. I'm Robert Yates from Chatham House in London. And if I may just quote the South African Minister of Health, who's quoted in today's Sowetan newspaper about the benefits of the WISH conference. And he says, it helps the world move in one particular direction, like the whole concept of universal health coverage, which in South Africa we call the National Health Insurance. And I couldn't agree more that I think this has been one of the great features of WISH, and also hearing the Minister refer to universal health coverage being one of the best ways to tackle with the re-emergence of communicable disease. And so many of the sessions I've been to, you've been hearing this as a theme to tackle mental health, dementia, and I really do think this is a whole theme that brings all these issues together. And it's a very sensible thing for the world community to rally round.
I'm not going to invite you to respond to that, except to say thank you. Number three. No, not because I've got to bring in. I want to bring in lots of people. Sorry. Three now. Ma'am.
Thank you very much.
You have to be very tough with him.
Edna Aden Ismail. I'm a midwife by profession. And I would like to call upon the world for a healthier world for mothers through the training of midwives, because it's not every mother in countries like mine who have access to excellent medical care during pregnancy and at the time of childbirth. I'm calling for better education for girls. I'm calling for better education for mothers about their health and their bodies and their condition. And midwives are very important partners in medical health care. So please do give a little bit more attention to that. And thank you very much for this opportunity.
You do respond to that.
Thank you, and welcome, and lovely to see you here. And I think I hope you enjoyed the panel with the Bill and Melinda Gates Foundation. I couldn't agree more with you. We could do more in improving the Millennium Development Goals, as I said yesterday in my speech. But I think there is a unique opportunity in workforce development, and also, as you know, our sister organisation WISE and Her Highness's passion to education. It's something that Qatar leads on, but I think we need to get that more of that globally.
And over there, number two.
Hi, myself Shilpi. I'm a software architect from Pentonix Healthcare. So one of our wishes is to reduce the cost of healthcare and bring down the healthcare to the poor people. But what I can see is like the cost of IT, the EHRs, health information technologies are drastically increasing. So we have a WISH Innovation Network. Are we having any plans in the future for the development of health innovative technologies from the WISH?
Did you get? Sure. I didn't quite get that.
Let me just try and summarize this. I think you were saying that technology is driving costs up, whether WISH will support innovative technologies in which cost may drop. The answer is yes. That's more or less the criteria we use downstairs on the innovation showcases, which are mostly about low-cost, high-impact technologies. I always say, in my own career, you know, I spent 10, 15 years of my life doing research and coming up with patents and technologies like robotic surgery. You know, I was in the era of very high cost, low impact. So I'm delighted to say I'm a reformed person too. I'm looking at very low cost and a very high impact technology. I think that's what the world is looking for.
And at number six.
Yeah, my name is John Monson from Rochester, New York. My disclosure is that next year I will have been a friend and colleague of ours for 30 years. During that time, I think we've both tried to be agents of change, as you point out, Hara. You know, this is an outstanding meeting, but one of the things that concerns me, and I don't know how to address this, so I'm asking you a question that I hope you have a better answer than I have. In this room today, we're speaking to the choir. Everybody agrees about universal health care, etc. Yet you and I both know that there are people sitting in offices as we speak working directly opposite that for political and financial and industrial reasons. And I just wonder how WISH can bring those people in for really hard-faced conversations. Because, you know, we can all agree on something today, but, you know, if you look at the John Boehners of this world, for example, I don't want to pick on John Boehner, but you know, he doesn't agree with universal health care, for example. And those are the obstacles to change that we truly have to address if we're going to succeed.
Just a minute before you answer, it was interesting at that particular panel when they were asked about universal healthcare, every hand shot up automatically as being in favour.
Thank you, John. And you always find people who resist change. And it's not just, I mean, you've listed a number of others, including politics, bureaucrats, and I think we've made that, I think a number of people touched on this. To make that change happen, you need political leadership. In some parts of the world, you may not have that. I think you need to distance health from politics. If someone is critical of universal health care, as the example you use, based on ideological reason that humans should, the fittest should survive, I don't think I agree with it. I certainly don't think this audience does, because ultimately I believe, and many of us in universal healthcare panel believe, that access to healthcare is a basic human right. Same way as Her Highness made a very strong point, access to education is a basic human right. And that we are the champions, and the stronger the voice of wish becomes, the more transformational it becomes. And ultimately, the people who really will drive change are the public. Are the public who will require and look for this and ask for this. And that's what happened when if I could use Murray Brennan's, I'm sure he's here in the cans. I'm not a revolutionary either, because I'm a bit old as well. Not as old as he is, but I think potentially engage the public, empower the public, and the public will demand and ask for that.
I said right at the beginning of our bit of conversation just then that conferences come and conferences go, and they come in. From here, if it's going to be effective, all these conversations, the millions upon millions of words that have been passed between one person and another overall, what would you like? How would you like to see? Because you have spent an enormous amount of time in this field, and you clearly. I can ask you one more question. It's true, because that's the one I asked the panel immediately before you, the quartet who were sitting here. And we did hear quite a lot of very significant people saying that individual personal experience made them really care. And that's what drives them in part. Is that true with you, or did you just come into as a cold, tough, able professional? I'm not saying you are cold or tough, but you're certainly able.
Yeah. I'm not sure I am able either. I think, in actual fact, it's a weakness that I've converted into a strength. I've always questioned everything in life since I was a child, whether anything could be done better. Yeah. And that's really what drove me to do, drive and improve things. However, I'm also not just not able, but I'm also foolish enough in life that I have been thrown in the deep end, being completely naive, and suddenly find yourself in jail and you need to get out of it. In other words, that is the time in which your creative button is switched off. How do I get myself out of this? And that's happened throughout my career. I mean, out of the blue, Sally Davis is sitting there. She will recognize when a prime minister calls me to come and become a health minister. When I went there, it was the most foreign place that I've ever been. And, you need to learn your survival to get out of it. And that's to be creative, you need to be, sorry, it's interesting. I mean, David Chetty said it today.
Yeah.
The lack of resources, he said money switches off your brain. I think it's the other way around.
A little bit of money does help.
I think lack of resources does switch your ability to be creative and address the problem before you. And we know this. It's a bit like you develop a resistance. If I could use the analogy of Dame Sally Davis, antimicrobial resistance, because we can just prescribe antibiotics. Health systems, the resistance is financed. The more money you throw into them, the less you get out of it. So back to, so it's for me, it's change and making that change happen.
So you helped make all of this happen with a great team under the auspices of Her Highness. How do you want things to go back to the question I did ask about? How do you want it to go forward? Where would you, if you were to say terrific thank you to people, what would this lot, with great respect to you all, what would they go away and do?
Well, I think I said this earlier. We've learned, we've listened to each other. Each one of you has an idea here, probably, I hope, more than one idea here. Do go back, try in every way possible, despite some of the bureaucrats that Monson et al. Was referring to make that change happen locally. What I beg you, if you do achieve any of that, do let us know, because it's important for us to see what is happening out there. We pick things up on the media, we pick things up when there's a parliamentary question somewhere, but we would like to know from you the impact of this in terms of what you do in your everyday practice, in terms of your leadership roles, or whatever it happens to be. And we also like some proper feedback in terms of the subject matter. Where do we take this to? What are the areas that we need to look at the next time? And we will also share with you what are the areas that we are implementing in Qatar and what is the impact of that elsewhere.
Harry Darzi, thanks very much. Don't go from...
Could I just... I think you mentioned the team. It's not me. You've had me here. You sit down, I'll tell you.
You say what you want to say.
Yeah, I just
It
want
is
to
your
say,
conference, after all, in the end.
I think it's very important to mention this. I really want to thank, firstly, Her Highness for giving us the opportunity to be here. You know, your leadership is really what brings us. And also, Your Royal Highnesses for being here. His Excellency, his support throughout the last 12 months has been absolutely amazing in ensuring we have 28 ministers. And then after, as I said earlier, I'm not able, and I'm actually foolish in many ways. The people who made this happen are all of you, but also the team that works here. Egbert Schilling, who's here somewhere. You saw him this morning. He's brilliant. We had Will Warburton, and we had Jane, and we had Noha, and a large number of other people who work underneath them. So I'm very, very grateful for all of their hard work, and also finishing off with Maria and Gita. This is a team sport. So anything you take back, healthcare delivery is a team sport. And what makes us more powerful is united. So on that note, thank you.
Don't you say that. I'm going to take a leaf out of Dame Sally's book and say, with a show of hands, if you would, just to be quite useful, you never know, encouraging to know, how many people think that it has been a really worthwhile 2 days? Would you put your hands up? Well, that is not universal healthcare, it's universal approval. Thank you very much indeed. Thank you, Your Highness, and as Ara has said, everyone has made it possible. I've really enjoyed it. I've learnt a lot. I've had wonderful conversations, and that's been a real privilege for me. And so it's all I do now is to say that we come to a halt. I leave you with a fleeting memory of what we've been doing over the past 2 days, and formally declare that Wish 2015 is closed. Welcome to the World Innovation Summit for Health in Qatar 2015.